The South African Medical Association has condemned alleged bogus Dr. Matthew Lani and others like him. The TikTok star was outed this week for pretending to be a qualified medical practitioner despite not having finished school. The Gauteng Health Department has now opened a criminal case against him, while the Health Professions Council of South Africa is launching an investigation. Let's talk further about this now with the South African Medical Association chairperson, Dr. Mzukwa. A very good evening to you, Doctor. Good to have your time. What's been most alarming about the revelations or how the story has played out in the last 3 to 4 days is how seemingly easy it is for someone to essentially impersonate or pretend to be a doctor.
Good evening to you, Temekte, and to your viewers. Thanks for having me. Like you said, it's so true. It seems very easy for people to just merge as medical practitioners, and whereas they don't have qualifications and they are not registered as such by the HPCSA. So it's a really something that is keeping us anxious, that there are so many of these such medical practitioners in the public sector as well as in the private sector.
And, you know, you may think, for example, when you think of a bogus doctor, someone who may set up a practice and not have a practice number, I don't know, in the middle of town somewhere. But when you've got a case where someone claims to work at an actual public hospital, and there's even at least one video of this young man seemingly walking through hospital hallways with a stethoscope, we don't know if he was actually seeing any patients. It makes you wonder how far that could have gone and the level of danger that people may have been exposed to either through advice or attempts to treat them.
Yes, you are quite right. I mean, I think people are really becoming very bold, you know, with this criminality. And, you know, if they can access institutions like hospitals, and who knows, maybe they've attempted to treat some of the patients. So I think it's something that we need to take it very seriously as healthcare professionals, as communities, as HPCSA, as government as well.
I was looking at your statement that you put out in reaction to this earlier, where you spoke about how it's brought to light the alarming prevalence of individuals falsely or falsely representing themselves as qualified medical professionals. But we don't know, do we, just how prevalent this sort of thing is. And that is where perhaps the greatest danger lies tonight.
Yes, I do think that, you know, we need to be very proactive in our approach dealing with bogus doctors. I know that the HPCSA has got an inspectorate unit, you know, in the provinces. But I do think that there needs to be a collaborative approach where HPCSA is leading, and also then us, you know, assistance from the non-governmental organizations, but also churches, as well as communities on the ground, law enforcement agencies. I think we need not wait for such, you know, revelations to occur, but I think that we need to be very proactive, you know, in finding out who is where in terms of these bogus doctors. Because like you said, they are everywhere, especially in those areas that are very busy, like your CBDs, your big hospitals, but also in the rural areas. There are so many of these bogus doctors who are hiding there because they know that it's hard for law enforcement agencies to, you know, be looking at those areas and finding them.
Except now it's not limited to a back room, let's say in the CBD. In this case, we're talking about a young man who we're told lied about being a qualified doctor and did so online. When you look at his following, for example, he had over 200,000 people following him on his one account. So social media and the professional work of doctors and the legitimacy, I suppose, of professionals in the space. How much of a complication has that become? How much has it muddied the water in terms of what doctors do online and how easily people can pass or pose as doctors online?
Well, I think, you know, social media has got its own pros and cons. And we have noted that during COVID-19, there was a lot of, you know, experts, you know, everyone emerging as an expert in healthcare and, you know, giving out information that is not evidence-based, you know, giving directions in terms of healthcare. But we know now that we need to be very careful of these online influencers. We need to verify if somebody claims to be an expert. I think it's upon us to go out and find out if this person is really an expert in terms of getting to know whether this person is a registered practitioner, whether this person is really having a practice number. But there's two things. If you are in the private sector, you need to know if you go to a doctor, you need to find out the practice number of that doctor. But secondly, you need to know the MP number, which is a medical practitioner's number, which is a registration number that is obtained from the HPCSA. Mm-hmm. And whilst we're still on that, I would like to urge all my colleagues to plead with them that when they are asked for this information, for the MP number and stuff like that, they should not be taking it personally, because we are dealing with fake doctors. People need to know, they need to verify, they need to be sure they are dealing with a real health expert, or medical practitioner.
And, it's advice to you and I or to other South Africans to check for a practice number, etc. But in this case of this young man, for example, the health department even used him for a campaign. They shared a video of him. Yes, they're now pursuing criminal action against him. But if the health department itself is not checking that who it enlists as a doctor for public service announcements is a doctor, what hope is there that an ordinary South African would think twice before even speaking to someone or double-checking their status?
To say the least, it is really disappointing that the whole Department of Health doesn't have checks and balances, making sure that whoever they are using is a real expert. They should, like we do in the South African Medical Association, we cannot register you as a member without having an MP number. So I think they should be doing the same thing, making sure that, they don't look at the quantity of followers, but they, obviously they go to HPCSA, they find out if they are dealing with a real practitioner, like you do in a normal employment. You can't just be catching people from the social media and using them. Actually, it was a disgrace that the whole department used somebody who's not a doctor.
And what does it do then, that aspect and this overall story, for the level of public confidence in the healthcare system?
Obviously, it causes lots of damage, in terms of people relying on the healthcare system, because if, for example, like you said earlier on, we have got the whole Department of Health, not taking due diligence in terms of checking the veracity of these qualifications and just grabbing anyone from the street and using that person, because that person has got a large following, I think it leaves a huge dent in terms of the integrity of the healthcare system. But having said so, we still have real practitioners on the ground. I think it will take a collaboration from all of us, the Medical Association itself and all other doctor groupings, healthcare groupings on the ground, communities, health, law enforcement agencies, to go out and protect, the communities. But also the HPCSA has got that legislative mandate, to be protecting communities and guiding the profession. That's what they actually need to do. They need to have a plan to make sure they clamp down on this matter.
Thank you very much for that. South African Medical Association Chairperson, Dr. Mvuyisi Mzukwa.